Hello everyone, welcome back to the Wildcat Sanctuary. Judson here. We are in our on-site hospital. Today's not Tuesday. Today is Thursday, where we typically do have vet days, and we wanted to take a closer look at Bobcat Athena. Caretakers had noticed some swelling on her face, on her right side, or left side rather. And here we are in our on-site hospital. We have Dr. Campbell, vet tech, caretaker Elise, here to see what possibly could be causing that swelling and see if we can help Athena out. So welcome everyone, a little impromptu live post. I said that the next time you'd probably be hearing from the Wildcat Sanctuary was from Tammy's Wildcat wrap-up, which will still be happening at 1 p.m. But Miss Athena, as I just explained, is being seen here in our on-site hospital. Caretakers had noticed some swelling in her face, and we wanted to get her seen to make sure that everything was okay. And they were taking a look at her mouth. They're looking at her teeth. Sometimes that swelling in the face can be caused from an abscessed tooth. Right now, they're in the midst of intubating her. Dr. Campbell getting a few other things ready. They're thinking that they have a tooth that they're suspicious of. So he's going to take some dental x-rays and just get a better look at that mouth. And perhaps we can get to the bottom of this issue. But as I was saying on our vet day earlier this week on Tuesday with Beauty, it is really just a testament to the level of care that our caretakers offer and the amount of expertise that they carry with them in and out throughout their jobs. And being able to look at Athena and analyze that, hey, this cat has some swelling in her face. Athena is one of 20-some bobcats here at the Wildcat Sanctuary, but as you guys know, we look at the tree and not the forest here. And it's just always, I commend our caretaking staff for their vigilance and being able to keep an eye out for any type of abnormality with any resident, from the smallest hybrid to the feistiest bobcat to the largest lion. Their ability to catch these types of things, alert our veterinary staff so we can then just kind of get on the case, take care of the situation, ensure that our rescues are happy and healthy. And it doesn't go without saying that type of care, that type of, how you guys are able to allow us to be prompt for our rescues is obviously afforded through your support. So thank you for that. Let me get into the comments here. Hey, Tanya Blanc, thank you for thanking us for standing up for Miss Athena here. And if anybody's just joining us, Athena had some swelling in her face, and so she's here in our on-site hospital for us to take a closer look at perhaps what could be causing that swelling. It sounds like there's maybe some suspicions of a tooth. It sometimes can be caused from an abscessed tooth that's led to a little infection where you see some of that puffiness. But we're going to be looking in her ears. We're going to be doing some dental x-rays and kind of doing all the things that we need to do to kind of track down the source of that inflammation. Thank you, Daria, for commending Dr. Campbell and the vet team for the awesome work that they do. It certainly is awesome, and awesome in the truest sense of the word, too. Thank you, Sandy G, for commending the team as well. And Athena, we know, lives with Bobcat Enzo and Wildcat Pines. And Athena's going to be checked out by the vet team here. We're going to kind of determine what we need to determine, and then Athena will be able to be returned to her indoor bedroom to recover and then eventually be joined back with Enzo for us to kind of further and maybe find a diagnosis for what could be the issue here. And there's Dr. Campbell just looking in her eyes. It looks like there's some type of stain, too, that you might see kind of coming out of the tear duct there from Athena. But that's just so Dr. Campbell can get a good look at what he's doing. Just looking at some comments here. Hey, Sue Button, thanks for joining us today. Robert Stern, thank you for commending us and praising us for the care we allow our rescues, and we wouldn't have it any other way for the rescues who called TWS their forever home. The cats come first, their well-being comes first, and it kind of exactly what I was talking about earlier. It's within the caretakers' training to make sure that the cat's health and well-being come first, which is why it's marvelous that they're being so vigilant and noticing things like this. And really kind of never letting anything fall to the wayside, making observations. The swelling was up, the swelling had gone down, and the swelling's back up, which means we wanted to kind of step into action here. But we won't hang out too much longer, anyone. I just wanted to obviously share with you all and just keep you updated on Miss Athena, and obviously to share how your guys' support allows us to do everything at the drop of a hat for any number of our rescues when we notice something is awry. And little Miss Bobcat Athena is being a wonderful patient so far. But
we do have two issues.
Okay.
One is there's a tooth back here. You can see live pulp back there. So that's a problem. Could be the source of a tooth root abscess. We typically see swelling down here. The initial swelling that we identified was actually up here, thinking that it was more of like a bee sting or something along those lines. And then if you notice, we've got a lot of conjunctivitis here, inflammation of the tissues that are surrounding the eye there. So we've got a couple of things going on. We'll probably address the tooth, treat the eye with some anti-inflammatories as best we can. She can be difficult with meds, and so we got a little bit of a challenge ahead, but we'll see if we can make her feel better.
Most definitely. Thank you, Dr. Campbell, for giving us the expert or professional take on what's been unfolding with Athena. And I hope everyone was able to hear Dr. Campbell. You kind of offered two leads as to what they're suspicious on, what could be causing this facial swelling in Athena. So obviously we're happy that they're already kind of tracking down what could be causing this discomfort for Miss Athena, and we're gonna get her right back to where she belongs. So hey everyone, glad you guys could take part in what you make possible here at TWS, the expert in preventative care for our rescues. Thank you again for tuning in today. Thanks for all the commendations to the vet staff and caretaking staff as well. Have a good kind of hour or so before you'll see Tammy, or not even an hour, actually 1 p.m. for Tammy's Wildcat wrap-up. So we'll see you back here at the Wildcat Sanctuary soon.